Gastroesophageal reflux disease. Pathogenesis and pathophysiology of GERD, step-by-step visual explanation, lower esophageal sphincter LES. Dysfunction. GERD begins with the dysfunction of the lower esophageal sphincter LES, a crucial muscular valve located at the junction of the esophagus and stomach. Normally, the LES opens to allow food to enter the stomach and then closes tightly to prevent backflow. In GERD, the LES either weakens or relaxes inappropriately, which compromises its ability to close properly. This can be due to several factors including high-fat meals, smoking, obesity, or certain medications. Increased intra-abdominal pressure. Conditions that increase intra-abdominal pressure, such as obesity, pregnancy, or heavy lifting, can exacerbate LES dysfunction. The increased pressure pushes the stomach contents back towards the LES, increasing the likelihood of acid reflux. This pressure combined with a weakened LES allows stomach acid to escape into the esophagus more easily. Gastric acid exposure to the esophageal mucosa. Once the LES fails to close properly, stomach acid, hydrochloric acid, and sometimes bile from the duodenum can reflux into the esophagus. The esophageal mucosa is not equipped to handle the corrosive nature of gastric acid. Unlike the stomach lining, repeated exposure leads to irritation, inflammation, esophagitis, and damage to the esophageal tissue, inflammatory response, and tissue injury. The acidic environment in the esophagus triggers an inflammatory response, leading to symptoms like heartburn and pain. Chronic inflammation can result in more severe complications. Symptomatic manifestations. The symptoms of GERD, such as heartburn, regurgitation, chest pain, and dysphagia, are directly linked to the damage and irritation of the esophageal lining by stomach acid. In addition to the classic symptoms, GERD can lead to extraesophageal manifestations like chronic cough, laryngitis, and even asthma, as reflux acid irritates the respiratory tract. Long-term consequences. If untreated, GERD can lead to severe complications. Esophageal strictures. Narrowing of the esophagus due to scar tissue can lead to difficulty swallowing, dysphagia. Barrett's esophagus, a significant risk factor for esophageal adenocarcinoma, a type of cancer. Esophageal cancer. Continuous irritation and cell changes in Barrett's esophagus can lead to the development of esophageal cancer. Thank you for your attention and participation.